Thank you for joining us at Welcoming Wellness this afternoon, where we are empowering mental health caregivers. I'm Robin, and I will be your navigator for this afternoon. And the purpose of our initiative is to provide knowledge and resources to caregivers of persons suffering from mental health conditions. We also aim to create a community of care where everyone feels free to ask for help when they need it. Welcoming Wellness is a mental health initiative of White Plains United Methodist Church in Cary, North Carolina. Okay, let's get started. Today we're going to hear from Angela Lassiter. And Angela has been with us before. She's an attorney in private practice here in town. And she spoke to us last time about the legal implications of mental health and mental health care. Today she's going to talk to us about something that nobody ever really wants to talk about, and that's the financial aspects of mental health care. So she's going to give us some tips and some ideas on how to be able to provide the care that your loved one needs. Let's welcome Angela.
Thank you, everyone. I wish I could say that this presentation was going to be interesting. Unfortunately, it is very dense material, so I apologize for that, but it will be informative. I will also tell you that while I am knowledgeable on this stuff, I am definitely not an expert. So I will give you a general basis and hopefully some good information, and you may have to go and seek out some more detailed information elsewhere, or we can research it together. So I may not have all the answers you're seeking, okay? So let's get started with dollars and diagnosis navigating this financial piece of mental health. So let's get started with supplemental security income. So what a lot of people call SSI. So in North Carolina, what I first will tell you is that all of these benefits you have to apply for, and you do that through the Social Security Administration. SSI happens to be a needs-based cash benefit for people who are age 65 or older, who are blind or disabled, and have very limited income or resources. So currently, the federal rate for an individual to receive monthly benefits, they would receive about $967 a month. And my eyesight is really poor, but I believe it says for a couple, it would be $1,450. So a lot like Medicaid, there are certain resource limits that an individual would have. So for Medicaid, the resource limit is $2,000 in a bank account each month. So that's the same limit that you have for SSI, and it's $3,000 for a couple. And it excludes certain things, like your primary residence isn't counted. A vehicle is not counted as part of your resource limit. So in North Carolina, if you are an SSI recipient, you automatically get Medicaid. So that's typically a greater benefit than the SSI monies that you receive anyway, because let's just face it, $967 a month is not going to pay for a lot of things. But Medicaid and having that insurance is a great benefit. So to apply for this, the Social Security Administration says you can apply online, you can apply by phone, or you can go into their offices. Good luck getting anybody on the phone at the Social Security office. So I will also say that with the Social Security insurance, SSI, you can work. A lot of people think that you can't work if you receive SSI. However, you can. What they look at is countable income. So they have earned and unearned income. And so what that means is that they'll ignore the first $20. They don't care where you got the $20 from, whether it's earned or unearned. They don't look at that. They don't look at the first $65 of earned income, and they only look at half of the remaining earnings. As long as you're under their cap, you can still receive SSI and Medicaid. We discussed how to apply for SSI. Online is probably the best starting point. With an SSI application, with all of your government benefit applications, the government is incredibly nosy. So they want to know everything about you. They want to know all of your financials. So they're going to ask for your bank statements. They're going to ask for your wages. They're going to ask for, where do you live? Is it a rental property? If it's rental, then they want your lease. If you own it, they're going to want that deed information. Do you have a mortgage on your property? They want to know who lives in your household. Is anyone providing support to you? They're going to want to know what your disability is, and they're going to want you to sign for medical releases. So with that information, they're going to have you sign all of these documents. They're going to ask you for a lot of things. They actually may ask you for additional testing. So they may ask the applicant to undergo what's called a disability determination, and that's where they can collect additional records or have you go to their experts to determine disability. And I know that you've probably heard this before, but when you apply for disability through the Social Security offices, most times you're denied the first time. Do not be discouraged if you're denied. That's just a jumping off point. So if you're denied within the 60-day time limit, because you have 60 days, ask for a reconsideration. So after the reconsideration, if you lose at that stage, request a hearing. But I will also say this, obtain an attorney to assist you with the process. So once you get beyond the first application and you're in the reconsideration, or you're requesting a hearing before an administrative law judge, you probably want an attorney that's licensed and practicing in this area, if that makes sense. Okay, Social Security disability income is vastly different from SSI. SSI is means tested. It's based on needing those resources because you don't have an income to assist yourself. Social Security disability insurance is because you have work credits and you have a disability that meets the SSA, Social Security Administration, their definition. So this microphone gets heavy. So you've got your work credits, you're applying for Social Security disability insurance, and you have a disability that Social Security recognizes. After 24 months of receiving your Social Security disability insurance, Medicare kicks in at that point. Again, you'll apply for Social Security disability insurance through the Social Security Administration. They're going to put you through all of the same hoops and have you jump the same hurdles as with Social Security, as with the SSI. So you're gonna do the application, you're gonna submit all the records. You may have to go through the disability determination. The cool thing about the Social Security disability insurance is that there are work incentives. So they give you a trial work period, so you get to test drive to see if you can return to work. So you get to attempt this for a rolling 60-month window. So during this time, you have 9 months that don't have to be consecutive that you can try to work. And as long as your earnings are below the amount that they cap it at, you can still receive your Social Security disability insurance, so your SSDI. Even when your trial period is over, you still have a 36-month safety net, which I think is pretty incredible. If your earnings are below a certain amount, and even when all of your Social Security disability ends and your you're out of work or you're able to return to substantial gainful activity, your Medicare can continue to go because you are still recognized as being disabled under the Social Security Administration. That one I don't have a whole lot of information about, but I thought that those were pretty cool, that you can at least try to work when you are disabled under the Social Security Administration guidelines. This is one that I just recently learned about, and I should have known about it sooner. But the disabled adult child or child disability benefits is what it's now called. So this is where a child, now adult, who is under the age of 22 and unmarried can receive benefits based on their parent's record if their parent is retired, disabled, or deceased. And so it's based on the parent's earnings. And the amount of those benefits are pretty substantial. In fact, I wrote that down. It can be up to $1,620 a month. So that is pretty substantial for a person to receive. Now, it replaces, most of the time, the SSI. So you have somebody who's on SSI, they transition off of SSI into, it's now called child disability benefits. They can keep Medicaid as long as they are still qualified under Medicaid's guidelines. But it's just something to remember and to look at if the parent is retired or disabled themselves or deceased, because the benefits, the monetary benefits, are greater than SSI. Again, you would apply through Social Security Administration. SNAP. We've heard a lot about SNAP in the news recently. So this is your food and nutrition benefits. It's administered by the North Carolina Department of Health and Human Services. You apply for it through the Department of Health and Human Services. Benefits are given on what looks like a credit card. It's an EBT card. And the eligibility depends on household size, the income of the household, allowable deductions. You can apply through what the Department of Health and Human Services has. It's called ePass. It's an online application, or through your county's Department of Social Services. So now there are work rules that exist for qualifying for SNAP benefits. And I'm sure that you've heard about these rules, that people who they determine are able-bodied adults have to attempt to work 80 hours a month unless they are otherwise exempt. These rules, as we have learned, are in flux and are subject to change, so please check with your county to see how they're applying those. And I think that we are currently doling out SNAP, hopefully in November. I think I saw in the news. Finally, North Carolina Medicaid, something I know more than a little about. So North Carolina Medicaid is means tested. It's your health care insurance for people who have low income. North Carolina did a great thing in December of 2023, and they rolled out an expansion. So in this expansion, it says that people who are ages 19 up to 64 years of age, who are in the federal poverty level, who make about $20,000 a year for one person, that those individuals can enroll in Medicaid, and it still applies for children, pregnant women, and of course the elderly, 65 plus, and the blind and disabled. So North Carolina has the expansion. And there's no monthly premiums for Medicaid. Generally, the copays are about $4. So it's administered, again, by the Department of Health and Human Services. And it falls into managed care or Medicaid Direct. We'll talk a little bit more about maintaining qualification for Medicaid and maintaining benefits with planning a little later on. For housing, we've got group housing and assisted living options. So in North Carolina, we have programs like Medicaid. We also have special assistance, which is kind of like a state-operated Medicaid program that also has its own income limits. So special assistance really helps out with these assisted living options, and it's administered by the Department of Health and Human Services. To get into these programs, you have to have what's called an FL2. So let's talk about what an FL2 is. It's just a form filled out by a doctor, by the attending physician, saying this is the level of care that is appropriate for the person. So we'll look first at adult care homes, family care homes, group homes. These homes are regulated by the Department of Health and Human Services. You can go online to North Carolina Department of Health and Human Services and look at their ratings. You can see where they've been inspected. You can see what's happened, what's been reported in those group homes, in those care homes, and see what their deficiencies were. So the state and county special assistance helps with payment of the room and board for these residents. And so it looks like I talked about it. Okay, so countable income must be below, and it has to be below, not 1 penny over what special assistance allows. So the basic rate right now is $1,428.51. It's more if it's a memory care unit. And then, and I speak to that in the next portion. So a special care unit for dementia can be up to $1,812.51. And it's more for couples. But for an individual, it cannot be one penny over. If you're 1 penny over, there's not a lot of spend down that you can do like you can do for Medicaid. There's not a lot of options there. But special assistance helps pay for these homes based on the level of care. So if a person doesn't need skilled nursing, they don't need much more than like supervision, somebody to do med reminders, someone to say, hey, prompting to like take a bath, something for like household maintenance. Let's clean your room. Let's do your laundry, prepare meals. These homes are good for that. So there's also community alternative programs for disabled adults. Those are your CAP services. CAP services are amazing. So they provide in-home aids, adult day programs, respite, all kinds of things, meal prep, delivery, personal emergency response. The problem with CAP is it's hard to get those programs. There's a waiting list to get those programs and so you have to get on that list early. But I think they're amazing at what they do for these individuals that need that assistance. This one also has a tremendous waiting list, but they do amazing things as well. This one's specifically for children and adults with disabilities that occurred before age 22. So it's a little bit different than CAP because CAP doesn't have that age requirement. But again, they provide extra supports and it's long-term supports for people so that they can remain in the community and not in these group homes or institutionalized. So they help with daily activities, the in-home and residential support, supported living, even assisted technologies. Like they'll do the vehicle mods. So if you need to like wheelchair accessible vehicle, they assist with that. They do job coaching, supported employment. They'll have an assistant go with an individual out to wherever they're working, even if it's Chick-fil-A, and greet people. So they also provide respite and caregiver support, crisis support. Voc Rehab is a program through the Department of Health and Human Services. And this one's pretty cool because you can refer yourself. It's the only program where you don't have to do a whole lot. You can just contact them and say, hey, I need services. And they will lead you through. You can also ask your school, you can ask your doctor's office for a referral over to Voc Rehab. They provide counseling, training, job placement, education, assistive technology. I was an impartial hearing officer with Voc Rehab, and they provided amazing supports for the blind, just technology where emails would be read to the individual. They would send people out into the field to teach individuals how to work the technology. They do amazing work, and so I can't speak enough about Voc Rehab. So I encourage, if you haven't looked at it, look at it. It's an awesome free resource that a lot of people don't utilize. All right, so here's your planning tools. Third-party special needs trust, also called a supplemental needs trust. So, speaking to you as an elder law attorney and somebody that does this a lot. If you have a loved one that has a disability, a mental health diagnosis, and you're doing your own estate planning, just touch the microphone, and you're doing your own estate planning, and you want to leave something to your disabled person, whether it's a child or an adult, but you know that, one, you don't want to mess up their benefits, or two, they're not responsible enough to handle the money, you can set up this trust as part of your estate planning, and this trust will allow them to receive benefits. You can pay for vacations, for respite care, for things that Medicaid does not allow for, that Medicaid doesn't pay for. So you can supplement, not supplant, their benefits. And so you can take monies that you would normally leave for them. You don't have to omit them from your estate planning. You can take that money and still leave it to them, but leave it into a trust, and it's managed by a trustee, so it has to be somebody that you obviously trust to manage this money for the benefit of the disabled person. And the good news is that there's not a Medicaid clawback. So Medicaid's not going to come and grab that money when something happens to your disabled person. So you can make provisions like after your person passes, you can leave it to your other heirs. You can leave it to their siblings. You can leave it to charity. You can do whatever you want to with it. But you've at least provided for them under the terms of your estate planning. What happens when your person who has a disability, mental health issues, what happens when they receive money and maybe they were in a car accident and they received a settlement from that car accident? So they need to do something with that money so that they don't become disqualified for their Medicaid benefits. Then you look at a first-party special needs trust. It's self-funded. We in the industry call it a D4A just because that's the federal code. The issue with a self-funded special needs trust is that, yes, there is a clawback provision. So you set it up, there's a trustee. It's not the individual who's got the disability. So there's a trustee that's managing the money for that person's benefit, not to supplant, but to assist the person with benefits that Medicaid's not covering, right? So you've got a trustee managing the money. They never have the opportunity, the person with disability, they can't make demands, they can't encumber it. But when they pass, Medicaid gets to come in, and they're the first parties that get to be paid when that person passes. So there's that clawback provision in those special needs trusts. Now there's also what's called a pooled trust. So a pooled trust is kind of like that first party special needs trust because you're still using the disabled person's money, but you're putting it in with everybody else's money to this nonprofit that manages this pooled trust. And the reason that you would do it is maybe there's just not enough money there to have their own special needs trust. So there's not enough money for that first party special needs trust, but you can put it in with other people, and it's cheaper this way. It's still going to be managed by a trustee, still going to keep them qualified for their benefits. And then when they pass, there's still the reimbursement to Medicaid, and anything left over stays with the nonprofit to help other beneficiaries. And that's based on whatever the trust terms are. Real estate transfers that are not countable for Medicaid qualification and will avoid that estate recovery. So it avoids that clawback. All right, so usually the major asset that a person owns is their home. It's the primary residence. So we said that whenever you are applying for Medicaid, one of the things that's not countable is your home. But when you're filling out your Medicaid application, they have you fill out this form. It's called the estate recovery form. It says, I know that whenever I pass, you're going to try to make a claim in my estate. Now, usually the Medicaid bill's pretty large. Well, the one thing that you have that's pretty large is going to be your real estate. And so they try to make the estate sell the home in order to pay off that Medicaid claim. So how do we avoid that? We can do a life estate deed. So what a life estate deed says is that, and I work with a lot of parents and children, so we're going to use that language. So the parent will keep the property for the entirety of their life, and then when they pass, the property automatically goes to their children. That's a life estate deed. So to make it Medicaid non-countable for Medicaid purposes, you got to do the transfer for value. So it's got to be a fair market value that the kids pay to the parent. Or you do the advanced planning. So if you got a, if you got a looking glass and you say, okay, 5 years into the future, I can see mom and dad's going to be okay. So today, we're going to sign that life estate deed, and I'm not going to pay a dime, and mom and dad's going to be okay. And so they're not going to need Medicaid for 5 years. And so that 5-year look back, they're going to be okay. You can do transfers all day to the community spouse. So community spouse is generally the healthy spouse that stays in the community when the husband or wife who is ill has to go into the skilled nursing facility. So you just transfer the home to the non-applicant for Medicaid. And then you have to do some real planning for the healthy spouse. So that community spouse, then you want to go in and you want to make sure you do the will. You want to redo some estate planning there. But what it does is it gets the house out of the name of the applicant spouse, the spouse that's in the facility, so that presumably if they pass first, then the house is in the name of the healthy spouse. And then my favorite, the percentage deed, the 1% deed. So the parent sells, not gifts, because we don't do gifts. The parent sells a small percentage, usually 1%, of the property to their daughter for fair market value. We usually look at tax value. In Wake County, that can be really high. And then the deed is written so that everybody joins together and they become joint tenants with right of survivorship, so that the last person standing is the winner of the property, and it bypasses the estate recovery. Okay, NC ABLE accounts. These, I don't know how often these are utilized. I use them a lot when I do guardianships, where maybe so in guardianships, there's the guardian and the ward. The ward is the one that's under guardianship. They're the ones that have been found incompetent. So the ward may have, it's usually about $5,000, but it's enough that they're not qualifying for Medicaid. So if I want to do a quick spin down, I can usually, do some pre-need like funeral planning, or I can utilize an ABLE account. So an ABLE account it's just a tax advantage savings account for people with disabilities. So the person with disabilities, is still their account, and anybody can put money into it up to $19,000 a year, and they still remain qualified for Medicaid or their SSI, at least up to $100,000. So this is the great thing, is that anybody can apply for this. So it can be the ward, which probably is not going to happen, but it can be a parent, it can be a guardian, it can be a grandparent, it can be an agent under a power of attorney. Anybody can set up this account, and anybody can contribute to it. And the great thing about ABLE accounts is that it's a wonderful way for a person who's trying to learn skills like how to grocery shop, how to budget, how to do things on their own. It's a great account to learn from. So there are certain things that they can utilize the ABLE account for, like housing. They can pay their rents. If they have a mortgage, so utilities, transportation. A lot of my people can't drive, but they can pay for Uber, they can pay for Lyft, they can pay their co-pays, that $4 that Medicaid will have you pay. They can pay that. They can pay for tuition and books and job training, and even recreation. So any kind of camps they want to go to, all of that can be used through the ABLE account, and it really helps train these individuals. That's at least what I've used it for with guardianships, just helping young adults who have disabilities learn how to actually use money, because they've not learned it in the past. So it also, I've heard it said that it's like the poor man's special needs trust, and maybe that's true, but I think it's a great asset to have alongside of the special needs trust, because then at least gives ownership to the person with disability. Medicaid compliant annuities. So when I'm doing planning for a couple, so we talked about the community spouse and the applicant spouse, right? So when Medicaid looks at spouses, they generally say, you have X amount of dollars, you divide it down the middle, and wife, you get to keep this, and husband, this is your amount, and husband, you're over resources by this amount. When the husband, we'll put the husband in the skilled nursing facility. When the husband's going into the skilled nursing facility and he's over assets, you can utilize a Medicaid compliant annuity to push him through to qualifications. So I use Cross Financial whenever I need an annuity, and it's a one-time lump sum purchase from an insurance company. In exchange, the company sets it up so that that money is paid in monthly increments for a set number of years or months. So when it's structured right, it's marked as spent and no longer accountable for Medicaid. So here's how it works. It has to be actuarially sound. So it's got to be during the lifetime. It's got to be equal and level payments. And it has to have a Medicaid payback provision. And I know you're all like shocked by that, right? Because Medicaid always gets their money. However, the Medicaid payback provision comes after the spouse, and that's why it works for married couples. Because you put the spouse in the first position, you make sure that it's paid out during the husband's lifetime, and you make sure that those equal payments come 1, 2, 3, and it's paid out in 3 months over equal payments during the husband's lifetime, and we're qualified. So Medicaid compliant annuities are pretty amazing for planning purposes. And we're wrapping up. So remember how I told you that anytime you're applying for government benefits, they are incredibly nosy. So these are the things that they're going to look for. And I'm hoping that you're going to get a copy of this PowerPoint. These are all the things that they're going to ask you for when you're applying, whether it's for Medicaid, whether it's for Social Security, whatever it may be. They're going to ask you for proof of identity, for your birth certificate, for your Social Security number, for your income, for your bank statements, the last 5 years, your healthcare information, your hospital records, proof of your residence, where do you live, any programs, whether you're a veteran, they want to know, and if you have any powers of attorney. So they're going to ask for all of these things. So it's not an exhaustive list, but it'll get you started on the right path.
Wow, she was really working under some blinding conditions up here, I can tell you that. We have a little problem this time of year with the sun coming in, I apologize. Finances are a very, very important piece of mental health care. Angela, thank you so much. I can't believe you have all of that knowledge in your brain. So thank you. And I wanted to tell you and remind you that, of course, our services are free. There is a big donate now button if you would care to donate on our website at welcomingwellnessnc.com. One more thing, another way you can help, well, I say one more thing, there's actually a couple more. Things that you can help us right now. If you are on Facebook, we are doing a big marketing push. And if you could follow Welcoming Wellness NC on Facebook and invite all of your friends. And that's the important piece, because you have friends I don't know. And we are trying to get this initiative out into the community more so that anyone who needs our help can receive it. Then we'd like for you to like and share our individual posts, which you'll see coming up on your news feed when you follow us. We are also on YouTube and Instagram as well. And you'd have to talk to somebody who's younger than I am to talk about how to get any of that shared. So anyway, if you could do that for us, that would be great. Also, if you are a member of a civic organization or a church or a small group of any kind, we have someone who will be happy to come and speak to your group about our initiative. So if you could just let us know, our email address is welcomingwellnessnc@gmail.com. And that comes directly to me. So if you have an idea or anything of how we can spread our initiative, we would love to hear from you on that. So thank you for joining us today. And those of you who have been around a while know that we take a break in the month of December. And everybody's busy, and we're busy as well. And also, you know, mental health can be a tricky issue, especially during the holidays. So we at Welcoming Wellness wish you all a happy holiday season. We encourage you to find joy, hope, and peace in whatever your holiday traditions are. We encourage you to extend and accept grace during this season of thankfulness and celebration. We thank you for your support this year. Please watch our website for our upcoming presentations. We will have another one in January. So thank you so much for being with us this afternoon, and thank you for your support. Good afternoon.